Good afternoon, everybody, and welcome to Zon Academy. Today is the second part of Dan Thornton's webinar series on denture conversions, and we're so happy to have him back today. Today's webinar is all on X, 100% digital workflow. And I just want to say that, we'd love you to be super interactive with us. During this webinar, Dan has prepared a couple of poll questions that I'm going to get started with launching pretty much right away. And we're going to have live Q&A at the end. So please bring your questions. There is a little icon at the bottom of your screen that says Q&A. All you have to do is click on that and we will answer all those questions at the very end. So Dan, I'm so happy to have you back. Thank you so much. And I'm going to turn this over to you.
Well, thanks for having me back. It was fun last time actually going over the all on X conversions chair side. So this is actually even funner. This is what I normally do every day, is kind of doing more of the 100% digital workflow with photogrammetry and grammetry and trying to get everything organized, ready to print, ready to mill for the doctor's office so the patient can actually have their teeth the same day of surgery. So it's going to be a little bit of fun. I'm going to do a little bit. We're going to touch a little bit on photogrammetry, a little bit on grammetry, just kind of briefly show you what they are. And so you're kind of aware of them. And there's more new stuff coming out almost every week anymore. So it's going to be interesting to see exactly where we are going with the digital workflow. Now, with that said, we'll go ahead and let's talk about a little bit of the photogrammetry. There's multiple different units for photogrammetry. And a lot of them's easy to work with. Most of the time you can just call the company, get the program. They kind of show you how to work with the program. So when you get the scans from your doctor, or if you're in an in-house lab, that way you kind of know how to work with it. The basic ones I normally work with so far is actually iCam, Micron Mapper, and OptiSplit is the ones that I normally work with offhand so far. Now, with that said, there's other ones out there that's coming out. There's a lot more of the internal IO scanner that has a scan body that they're using for photogrammetry now. Is actually kind of a neat to watch to see as they work through the process to see if it's actually as accurate as photogrammetry or if it's going to be the next best thing. Which everybody can actually have that. Everybody can reuse the scan bodies. You're already using the intraoral scanner. So it makes sense to kind of try to add those on to see. They also have the reverse ones to where you can actually put an analog like later on for your finals. I'm putting an analog on like your temporary where you can do the scans using analogs that will become your scan bodies so you can make for the final zirconium. It's very interesting how we are changing so much with the dentistry from the old traditional pickup impression, verification jig, let's verify the implants, let's do the model work, do all the setups, do the wax try-ins, that now I'm so excited because it's 100% digital. It makes it easier to kind of keep track of all that because it instantly comes in and then you can actually instantly put it into your system. You don't have to wait for model work. You don't have to wait for a soft tissue model to set up. You don't have to wait for all the articulators to be ready for you to mount cases to start getting them moving along. You don't have to wait for denture teeth to come in. You have all your stuff already with you in your computer, your design stations. Now, with that said, you can actually do the 100% digital workflow with 3Shape or exocad. Which one do I prefer? That's a whole different story. I like both. It depends on what I'm doing with it. I actually run with both systems. Most of the time when I'm doing live surgeries, I'm actually running off of exocad with a pre-designed temporary that's actually just waiting for it, because I normally have the case at least a month in advance. So I have time to do a wax up, kind of get everything ready for it. And then I just start waiting to get all the scans with all the scan markers, and everything else so I can start stacking the case to get ready to actually do the final or the surgery temps, which that makes it easier. As you can see, we're going to move to a little bit more of the scan markers. The alignment strategy is something that you got to think about. And a lot of times you got to talk to the doctor and see what the alignment strategy needs to be or is going to be. And it can be anywhere from palatal markers. As you can see, it can either be screws or it can be like Digital Arches actually does a very nice arch tracer. And that's the one that I like. It has a lot of grammetry on it. The other way is to actually do more or less like a denture, do a wash underneath of it after the surgery is done. That picks up the caps that you can use for alignment. You just have to 360 scan that, scan the bite. You can do half the surgery and then place the implant scan caps on top of that, because you have to have something in your first scan and something of your surgery scan all the way through to the final. That way you can have something that you can reference as you go through your stacking on your cases. You can also take an impression that normally has caps in it. So it's technically like a denture, but sometimes you can actually even make a bite tray that somewhat has teeth on it, kind of helps you with the stop to kind of do the impression. Most of the doctors I work with use the palatal markers, or they'll leave the back molars for me just for the alignment strategy. And then after that, they remove those teeth or they remove the markers after they're done with that final scan. They'll check before they actually take them out to make sure I get the good scan. Now, with that fun stuff, it's actually when we get the scans in the lab side, as you can see, most of them are just kind of hanging out in space. They're not in bite. The only thing that we have is normally our pre-op models that will actually be in bite. You know, if we need to open the bite, do we need to close the bite? And most of that will be relayed to us by the doctor, or if we are actually in the office, we can talk to the doctor, go over the case with the doctor, and actually figure out if we need to reset the patient's bite to what it should be, or we are just going to kind of go with more like a FP1 that's just going to be teeth, or an FP2 that's going to be teeth and a little bit of tissue, or an FP3 that's going to be teeth, a little and a lot of tissue. That one's when you a very severe case, and I don't do many of FP3s. Most of mine are FP1s or FP2s. So as you can see, you can get a lot of different styles of scans in from the office. If they have an iCam, they can actually change the grammetry of the photogrammetry for us to an STL. So we can actually use that to align with their tissue scans. That way we don't have to go back into the iCam system and reset everything. Or if you have the iCam system on your computer, you can pull everything in, realign it with your tissue scan, with your photogrammetry, and then pick what kind of scan body you want to use, like Des, Nobel, Straumann, some of the other ones out there, Sin. Yeah, and you can pick from any number of screws to use. Definitely make sure they are clear with you with what screw they want to use in their temp, because everyone's going to be different. And then even with that, if you're multi-units, some multi-units on different implant systems are different heights. So you're going to have to watch that also. You got to make sure you grab the correct library, or if not, your temp's not going to fit very well, or your screw's not going to engage into your multi-unit. So what I did is I actually have a case that's kind of waiting and floating around in space, and I'm going to actually put it together and stack it for you. And we're going to step it through. Give me a minute to find it. All right. All right. So right now I just kind of have the case set up. I still need to put in what we're going to do with it. So we're going to say number 2 is going to be an implant. And since I already have the wax up already done, it's floating in space waiting for all my final scans from surgery. I want to set it up as a wax up. Say a screw retain. You can put like your pre-op in here if you need to. A lot of times you're going to have to because your pre-op is going to technically be the model you're going to align to. Or if not, if you forget it, you can always go into expert mode and bring stuff in later. So we're going to have 2, 5, 8, 9, 12, and 15. And everything else can be aponic. You don't have to connect them since you're doing a wax up. It automatically knows that you're connected. All right, it's going to ask you what scans you need. See if you can see that. Yep, you can see that. All right, for upper scan, see which one I had.
Right now, Dan, I'm just seeing a gray screen.
You seeing the gray screen?
Yeah.
Okay, I get you. It doesn't like that. We'll go over here. We'll share this one. Now you'll probably see a real big gray screen. Because right now it's just trying to add in the scans, and it's throwing all my stuff all over my computer system here since I run with 3 screens. All right, scan marker. Pull the wrong one. Good news is if you actually mess up, you can just kind of close it. Don't save your thing like I just did. And no stress of a webinar. When you forget how you stacked your scans.
That's okay.
Make sure I'm back on 3. So that one. Plus of the day, you want the pre-op model. And a lot. All right, Fran, can you see that screen?
I can see it. Yes, thank you.
All right, so let me bring all the case in. You can actually see what I'm talking about. It just kind of floats. And you see, we just kind of have all the scans are just like tossed all into each other. So you go into expert mode. And you can align scans. Kind of grab them, pull them apart. And we'll go ahead and get rid of the wax up. The wax up's already in bite. You can see right now with this, this is my tissue model. It has my arch tracers in it for alignment. So I'm going to actually bring in another scan. And I can actually just call it partial framework, whatever you want to call it. And then I'm going to grab the upper teeth. No, it's not aligned. And you see it come in kind of sideways. So now with that one's going to be my teeth with scan marker. So this is going to be my alignment strategy right here. So the first thing I got to do is actually align this with that pre-op model. Here the posing. And we just click places that we want to align with. And you see we get a nice rainbow going on. That's pretty good alignment. If you want, you can actually check the cut. You can see most of that scan matches really, really well. So then after that, I just kind of come back and keep doing the same thing with the other ones. I don't need the pre-op anymore because the pre-op is just what I needed to align with the alignment strategy. And now that we have the arch tracers, that will be our alignment strategy now. So I'll actually just make connections here. But what I can see is in this scan, it looks like one of the arch tracers may have moved. Sometimes it happens, it gets bumped with a bite block. As long as both of them are not moved, we have a pretty good chance it's going to line up pretty well. Let's see how it works. All right, we still have some good tissue area that wasn't disturbed very too much. And you can see one actually looks pretty good. This one kind of moved a little bit. The second one was actually more of a backup. You can run with one. I prefer to have two. You can see they tried one over here, but the palatal bone wasn't strong enough. And it's probably what happened here. Just got knocked out of the way a little bit. So now after that, we can get rid of the pre-op and also the one we brought in for the alignment strategy. This is more of our tissue. I already brought this into the iCam and changed it over to DES. So there's two different ways you can do this. You can actually bring this in and align these. With the scan bodies you already have there. But a lot of times what I do is when I combine the model, I combine it with the scan bodies, and then you can actually bring it in and you can actually delete this model. So if I brought the scan bodies in as a solid model like this, I could delete the tissue area and already have my scan bodies in. So that'll tip. All right, same thing. I'm just going to do the alignment strategy, just kind of pick on them. So you can see they went blue. So that's an exact match. Okay. Now we can get rid of and click on surface. As you can see, I already had the ones alignment strategy already in for those. Make sure I have those off. And then you can delete them. Now with your tissue, myself, I suggest actually coming in kind of smoothing the scan bodies off. Sometimes it leaves like stuff floating and it gets into your temp and it doesn't form right. It has like something inside your temp. And then you sit here and fight with it for a while till you actually figure out that you picked up something off your tissue scan. Now, there's other ways you can do it. You can actually cut this. You can actually, how I took care of the other ones, you can actually just do a little circle around them and make a complete hole in them, because it's going to put in your analog in your multi-units. Myself, I kind of like just smooth them off a little bit. And a lot of times if you have a nice fresh surgery, you can kind of just kind of go over your tissue a little bit, make it a little bit better for the healing. Because we kind of help that tissue when we can adapt it a little bit to our temporaries. If we can do a nice flat intaglio, that's good. We just got to watch sometimes with our tissue that if we push too hard, we're going to actually get into where there's not enough tissue underneath the temp, and then it's going to cause a problem down the road. All right. So now that we have that, we have the desk here waiting. We have our alignment strategy for that. Now we're actually ready to take it back to Wizard. And it's going to want us to go ahead and mark where our implants are at. Let me just pick what we want. And see, it aligns pretty well. Let's see, as you can see, we have all of our abutments in there now. Now you get two different ways. You can actually just kind of click through it, and then you can make the emergence profile, or you can actually kind of draw a circle around that on the tissue, kind of your preference on what you want to do. Myself, I normally just click through it. And that's one. And then we can actually set what our offset's going to be. We can pull these, make that platform bigger, make that platform smaller. You can actually make it higher. Myself, I normally have a preset. So I can just do one all at the same time. And you see the wax up's already in bite, ready to go. I just got to take and fix a couple areas where some of the implants are coming out of the sides or a little bit further back than what I planned. All right, now that we have those in there, and it did a pre-calculation of where those implants are going to be, I want to show you guys a little cool trick. So if you have something, let's say the office sends you, like the iCam has its own scan flags, and they sent you the photogrammetry and the STL of those scan flags from the iCam system, and then it's just kind of floating there. You can align it with your tissue and then have everything kind of like line up. But now when you pick your library, it only goes to a certain library. So like now I picked the desk, I made the desk library, but if you go after you get to this point, you can actually go to expert mode. And if you click on the analog, you now can change that grammetry. Now you can pick whatever else you want to pick. So let's pick, well, matter of fact, here's the ICAM library. So let's pick this one. As you can see, it just comes up with that library, that scan flag, click OK. You can see it's there, but you don't have to touch the scan body that you already aligned. And now that is a different grammetry. It's a whole different analog, different screw, everything. As you can see, has a little less space than the other ones. Has a little bit taller cone. And then you can go all the way through all of these and actually just change your grammetry of whatever you want from the library you got. So I'm going to just kind of leave that one alone. Leave it changed. And when you go back to your wizard after that, it'll just take you back, recalculate that one screw channel. And then you can actually proceed forward to, if you want to move some stuff around, you can grab and pull. Try and get that screw inside that. You need to move the cuss tip out. Make that tooth a little bit bigger. Now, depending on what screw your doctor wants to use, you could actually change these. I'll go back in expert mode and I'll show you what I'm talking about. Because if you actually have ones a little bit more for the angle changing screws, you can do that for these. So I'm going to change this grammetry here. I'm going to do one real quick that I know I can change. And that screw is down. And see, that's a scan flag for the micro mapper. Now, when I go back, I can actually change that angle. A lot of times you gotta go back and actually get back to here. And now I can drag it. For those two, you can actually drag where your screw is going to be now. So if you want to make this one a little bit more closely, yeah, let me. Oh, that's one set it's in, that's why. Okay. So since I picked one, is you can actually angle that screw channel. Now we'll actually tip that hole up. This works out very well for the printed temporaries. When you start getting to the final zirconiums, you definitely need to know if your mill can handle that angulation for that screw channel. Because a lot of times it'll just mill straight down inside. It won't open up that platform inside for your screw to fully engage. And you see my occlusion's a little high on a couple areas. So you can actually just go to one of your cut features. You can either do it one or two ways. You can actually pull it down. You can just smooth it off. You can actually just adapt it, which is actually just going to flatten that cut. As you can see, it's just nice and cut that. So then you can go back and just kind of smooth it. If you need to, you can show your distance map. You can also do the adapt to your tissue. And you only do 0 at first, just to kind of see where it cuts out. It gets rid of a lot of the other areas and they go back in and smooth it out. Because like certain areas I can see, like on this number 10 area, it's gonna be nice and sharp right there. It almost made a horseshoe, which is something you don't want to do in these kind of cases because you make nothing but a food trap. And if you don't know exocad, what I'm doing is I'm smoothing it out, but I'm pushing shift. That makes it a little bit more flatter compared to regular smooth. If you have the add and remove, you use your shift for remove. If you're using 3 shape, you guys can just toggle through your numbers for your add and remove tool. It's like right now, I don't care if it actually shows up red, like I don't have anything there. You want to backfill, make it a little bit better. Now, one of the other ways is doing this, you can actually have your teeth just waxed up, waiting for your gingiva. Now, I actually haven't tried it, but I'm curious to see if I can add gingiva to just regular teeth. From what I understand, is you can bring it into the expert mode, and then add gingiva to those teeth. So then you can actually be a little bit faster cut on the tissue area. Myself, I normally just put tissue just in case we're going to actually do a denture, then I'll just kind of remount those tissues a little bit. Or if I need to just kind of print that temp without holes, I could do that too. Depends on what surgeon I'm working with. If I know they're going to be a FP1 or FP2. If I know we're going FP1, I normally just kind of have the teeth hanging out there. And then I'll just adapt all the tissue and everything to them. I'll form the tissue a little bit better to go in the sulcus. That way it's a little bit more like an FP or regular crown and bridge case. Especially if I know there's teeth, like space is going to be there from the teeth. It's good. A lot of times if it's a toothless area, then we don't know if they created that pocket for the tooth. So then I would just kind of adapt it to the tissue. Now you could actually, and normally if I'm doing this for like the final cases or final attempts, I take a lot more time, a little bit more detail compared to like if I was at surgery. I'm going to kind of move pretty quickly because I want to get the temp into the print as fast as I can. Because depending on what printer you're using, it could take anywhere from 20 to 40 minutes for it to print and what material you're using. But you got to remember you have your wash cycle or your hand washing for some of these materials. Then you have your curing time also on top of that, especially if you're doing this chair side. Now, a lot of times with my surgery, Tim, a lot of the surgeons I work with, they want to actually make sure that we have a good tripod hitting on our occlusion. Kind of keep off the posterior implants. Sometimes we want them all the way across, depends on who I'm working with. Now, for that to be said, a lot of times the interior teeth doesn't have a stop. I will actually build the tissue up like this to kind of give it a little bit more of a stop on that tooth. So it gives them a little bit more of a biting surface just to help protect that implant. So it's not overloaded too much. And then just kind of readapt it. Because even when both alignment strategies, we had one of those arch tracers that moves. I also warn them, I'm going to do my best to kind of line this up. We might be off a little bit. And then you just have to kind of grind in chair side when you put it in, put the plate. But everything else looked like it was going to be spot on. So it was pretty good on that. Like I said, if you don't want that, you can actually go over, you can just kind of grab your tool. You can just grab the tooth and kind of pull it out. Especially if your tooth's going to be a little thin. Because once you got to think about it, you got to think about also, is your material going to handle the forces of the bite while they're healing? Does these break? Yes, you can have these break. The good news is we can turn these around pretty quickly. We can actually have another set printed, or if not, at the same time frame. Some offices print two at the same time. That way they already have a backup just in case. Now, with that said, I've actually had patients that go all the way through till we get to another temp. It has no problem, doesn't break them or anything at all. And I've had ones that can't even make it 2 weeks. And sometimes the one that makes it less than 2 weeks is even a thicker one than the one we're working on here. It's either they're not listening for the diet they should have, or they just have a really bad grinding habit. That's a time frame. All right. I'm gonna kind of speed it up a little bit because I'll kick it over into the printer program so you guys can see normally how you nest it. See, it's not too bad. I'd still finish it up. I'd actually smooth up all this area, kind of make it a little bit more cleansable, and make this a little bit thinner so I can get down in the tissue. We're not too bad on pushing because I'm going to push the tissue just a little bit. But like I said, some of the offices I work with, they'll actually send me a pan so I can see where the bone's at compared to the multi-units. So let's step forward. All right, now we're actually where, it's funny, when I first started using exocad, this kind of came in a little bit afterwards when I tried to figure out what this was. But it just kind of helps you with the screw holes. You can actually change this. You can make them thicker. You can make them taller. You just got to chase down the little white dot. Thicker and taller. You can change them automatically. The funnest thing is kind of going in and playing with all your little CAD features. And I know a lot of us technicians, we kind of get a streamline of what we want to do. And we never play with anything else unless we accidentally hit it one day, or we see a webinar, or we're talking to somebody and they're like, oh yeah, have you tried this? And then we're like, oh, okay. Because that's actually how I learned how to change the analog. Because I was talking to one of the other technicians and he showed me how to do it. And I'm like, oh, that changes everything, because then you can actually move that case along with anything from any scan body that was sent to you to the scan body you need. Now, if you're doing this with the iCam and the doctor's office set that screw and set that tissue model together and stacked it for you, then he's already, or they've already said what screw they're going to use and everything else when you bring it in. So normally then you don't have to change it, because if you start changing it, that's when you're going to have a problem, especially if they're printing in the office. You don't know how it's going to be cleaned. If they do not clean the holes out very well and they just kind of cure some of the materials in there, the screw channel and the screw holes are going to be a little too close, and they're not going to get the screw in, and they're going to be like, well, you picked the wrong library. Or they could get a screw lodged in there if they're actually putting the screw in with the analog while they're curing the temp, that it can't actually lock in. A lot of people said when you do the temps and you cure the temps that you could just leave them like this. Other ones say put an analog on it with a screw so you know it's got a nice fit to the analog. My suggestion is watch the analogs you're using, because some of those will have undercuts because they plan on their system when they do it. that's going to be a titanium base. And then if that material gets in that undercut, then you're going to have a little issues because it's going to kind of get stuck. So I'm going to switch over screens. I'm going to bring this into, where did I lose my screen? Bring this into the printer program now. Screen 3. And you're going to share. Okay. Now, what I did is I got that finished. Now I can actually go and pull that temp, that STL out, and then just kind of bring it over and drop it. Tell it what it's going to be. Prepare the print. All right, that's what this program actually gives you. It presets the things. Now, if you want to change it, turn that off, grab your tool, and then you can edit your connectors. Myself, on these, I actually like to have 3 on the large teeth. That way I feel like it prints all the way through to the edge. I watch where the connector is on the dot by the screw hole. I kind of move them back a little bit just because I don't want it to fill in that screw hole by accident. Myself, I don't like the ones that go down the center of the teeth. So I normally always take those out. I keep on the more of the ridges just to make sure any little spots maybe on the side that doesn't have a support. And then now you're off to print. If you want, you can actually duplicate that. You can actually click on it, tell it you want to duplicate it, put 2 in at the same time, and then you're off to your print. Let it print whatever time frame. Then you wash, cure it, do your little staining that you want to do on it. If you want to put a, well, normally you would put a clear coat on it. I've heard some people have actually just been polishing it with a little bit of polish instead of doing any kind of the clear light cure. So it's technically on what you want to do. All right, Fran, you want to launch our last question?
Of course. So this one is, what printer are you using in your laboratory? Well, let's give this a minute. And then when we're done, I believe that we do have a question in the queue for you, Dan.
Okay. Awesome.
And we could go over the polls as well.
Awesome.
So
Just
it
to answer
seems
this
like
poll so
as
everybody
far
knows,
as,
I actually have a Sprint Ray and a Siga.
okay. But it seems like 33% of our attendees have a Sega printers, 8% Sprint Ray, and 58% other.
I've seen a couple out there that's I can't remember their name. They printed pretty fast.
As far as in office labs, only 8% are in office labs. Other 92% are standalone businesses.
Great. We need more of us out there actually doing this chair side. It's a big demand right now.
We have 70% of our attendees that are 3Shape users and 30% are exocad users.
I can see it. I was a 3Shape user until I started getting into it. And then when I started doing more of the surgery chair side, it was a little bit easier with exocad. It made it an easier transition to go from one to the other. With 3Shape, you got to learn what you need to put it into. Like how I set up that model with the desk scan bodies would be how I would also set that up for 3Shape. And then I would step that through. Now, I've seen a lot of other people doing it more or less like you have the pre-wax up already done and you're pulling it into 3Shape to kind of do it that way. I'm pretty fast at 3Shape myself, so I know I can actually probably do a full straight off scratch wax up in probably about a half an hour to an hour. But if you find the little easier ways to do it for yourself, you want to love it.
So Dan, you use 3Shape as well as exocad in your laboratory?
I do.
I'm
I've
finding,
run with both.
yeah, I find that a lot of technicians are now doing that. We actually are going to be having a webinar on that in January of why you would want to use both. So that's pretty cool that you do. I'm so excited about that.
Yeah, it's funny because there's a lot of like certain things with 3Shape. I like it easier with exocad, and then some things with 3Shape is easier than exocad. And there's a
Mhm,
lot of like I like the dentures from 3Shape. I don't like the dentures from exocad.
mhm.
I like how easy it is to transition these kind of temps and finals in exocad than I do 3Shape. But it's one of those things you just kind of learn and you adapt to whatever you can do.
Right, right. And having both platforms allows you the flexibility of being able to say, okay, I like this better, so I'm going to use this for this and that for that. So that's pretty cool that you do it as well. I've been speaking to a lot of people, and that's what, I've been hearing is, oh yeah, I'm investing into my lab. I just bought, exocad software or vice versa. So that's really very interesting. We have the question. I'm going to read it to you. So Darius wants to know, for grinders, is it good to make soft night guards for the temporary?
You can. Um, it wouldn't be a bad idea. Now, the only thing is I'd probably put it on the opposing teeth compared to your temp, just for the fact you don't want them to kind of keep pulling on that temp, just for safety.
Awesome. I'm going to keep this Q&A open. So please, if you have any questions for Dan, just type them in at that icon at the bottom of your screen. But I just want to let you know what's happening next week. On Tuesday, December 17th, we have the digital transformation and the journey of implant dentistry. So that's going to be a very interesting lecture next week. And I just want to let you know, January and February education is well on its way. So please keep an eye out for that on Zon Academy and sign up. We have topics, as far as exocad denture design. We're going to be speaking more about photogrammetry. We have Zest joining us on, Zest locators. Again, I have a lecture on why use exocad and 3Shape in your laboratory and not just settling on one design software platform. And I want you to really make sure you look out for Chicago Education at Zon. We're going to be in Ballroom E&F like we are every year. This year, we have triple the amount of education coming at you. We have 3 days of education from Thursday through Saturday with glass classroom lectures and table clinics running all day from start to finish. So you will find some great lectures, some great KOLs in there speaking. It's going to be great. And our ballroom is going to be a lot of fun. So I encourage you to keep your eye out on, what we have in store for you in February. Dan, I want to thank you so much for joining us. This has been great having you for these 2 lectures, and we appreciate your time here at Zon and your expertise, and I'm sure all of our attendees do as well. So I want to thank you all for joining us today, and especially you, Dan. Thank you so much.
Thanks for having me.